Everybody. I'm Tonya Shepherd Hatfield. I'm a family nurse practitioner from here in Floyd County. I'm going to do a little quick video talking about gloves versus hand sanitizer, especially when you're out in public. Now, this don't really much matter when you're at home because the germs that are in your home are pretty much your germs. So when you go out in public, though, I am recommending, along with many other healthcare workers and nurses all over the place, the CDC is really not even recommending that people wear gloves in public. They are recommending the masks. They absolutely are recommending the masks. Um, the masks are there to slow the spread. That slows the spread of my germs to you, just like it slows the spread of your germs to me. That is why the masks are there. The gloves, are a little bit trickier. Um, People wear gloves and it gives them a sense of security that just because their hands and their skin aren't touching these items that they're safe from it, but they're really not, because you get forgetful um, about where you've put your hands when you're not actually having that tactile sensation. So gloves, you put gloves on, you go into the store, you're grabbing all of your grocery items and putting them in your cart. You're grabbing your cart, you're pushing it around, you're picking things up, and you're looking at them. Every time you touch anything you touch with your hands, you are picking up new germs and you're transferring them back to your cart. So you're cross-contaminating everything. And if you pick up an item and look at it and decide you don't want it and you put it back down, you've contaminated that item too with your gloves. The same, it would be the exact same as if it was with your hands, with your bare hands. The thing about your bare hands, you're going to be more aware of where you are touching if it is your bare skin. You're not going to be touching things that you're not going to be putting in your cart. You're going to be more aware of not touching your face. You should have your mask on when you go in, and hopefully your mask fits you okay, because there's a lot of people that I've seen in their mask because their mask will slide down. So try to get your mask where it needs to be. If you've got your gloves on, or even if you are barehanded, you still shouldn't touch your face. It doesn't matter. But if you're barehanded and your mask starts sliding down and you have your hand sanitizer in your purse or in your pocket or wherever, you can put your hand sanitizer on, you clean your hands, and then you readjust your mask. Don't touch your mask with dirty fingers. Don't touch your face with dirty fingers. Don't put your fingers in your mouth. Don't pick your nose. Don't pick your kid's nose. Anything like that with dirty fingers. Keep your hand sanitizer with you and just wipe it off and readjust your mask. With the gloves, if something happens and your mask is falling down, or you have to swap your hair back, or you have to use your phone or whatever, you've got to go through the whole job of taking these off in order to be safe. And then what are you going to do with them? Are you going to put these dirty gloves back down in your purse? You're going to put them in your pocket? People are throwing them down on the ground. We don't need that. It's just an extra step that you don't have to do as long as you have your hand sanitizer. You just get rid of them. Don't even worry about the gloves. As long as you have the hand sanitizer and you have it with you, you can clean your hands 100 times in the store, but you can't change your gloves 100 times in a store. I mean, who's going to pack around 100 pairs of gloves with them in the grocery store? Because technically, in order to keep from contaminating everything, you have to change your gloves every time you touch something. So in order to keep everything where it needs to be. So you got your gloves on, you grab your coffee, you put it in the cart, you need to change them. You go to the next item, you grab whatever it is, your cereal, your oatmeal, whatever, put it in your cart, you're supposed to change them. In the hospital setting, that is ideal. That is what you do. You don't cross-contaminate anything. We change gloves between patients. We change our gloves between tasks with our patients. I don't use the same set of gloves to do anything, to start an IV and then feed somebody with those gloves. No, you have to change your gloves between that type of thing in order to keep them contaminated, because you don't go into a patient room or anything like that and use the same set of gloves for every task that you do in there. You just don't do that. You'll make somebody sick because you're going to take germs from one spot in that room to your patient. The same thing goes for you when you're out in the grocery store shopping or anything like that. Don't put don't put the gloves on when you're doing medial tasks like that. Whenever you're going and getting your groceries, take your hand sanitizer, clean your hands several times through the store. Always clean your hands before you get back in your car and start driving it. Make sure your hands are clean. When you go out and you're pumping gas, you pull into the gas station, most everybody uses their cards at the pump. Those pads are totally gross. Everybody's been touching them, punching in their numbers or whatever. So you get out of your car, you pump your gas, either have your hand sanitizer in your pocket, or as soon as you open your car door, it needs to be right there somewhere that you can get to before you get back in your car. You get out, you pump your gas, you get your seat, you do whatever, and then you use your hand sanitizer before you get back in the car. Some people are using, I've seen them using paper towels and tissues and stuff like that to hold the gas nozzle. But as long as you're using hand sanitizer to get back in your car, that's fine. ATM machines. ATM machines are also contaminated. Those keypads, everybody's been through there touching them and punching their numbers in. Always use your hand sanitizer after you've used your ATM. Money's dirty too. So just after you've handled your money, make sure you use your hand sanitizer. When you go to fast food restaurants and you reach them your card and they reach you your food, you get your card back, use your hand sanitizer. I'm pretty sure they are too. So, and because they're supposed to. Some of I've been to several restaurants and some of them are using gloves and some of them are not. I would prefer that people like that are working with the public, that they would just use hand sanitizer a lot too instead of the gloves, because they don't change them enough and they cross contaminate things. You have to think like you are contaminating everything whenever you are out in the public doing anything, because everybody in front of you has already contaminated it. Assume that everybody has this virus and you don't want it. Assume that you have it and you don't want to give it away. So wear your masks when you're in public to decrease the spread. Use your hand sanitizer. Wash with soap and water whenever you can. Don't use the gloves. Always social distance, 6 feet at least from everybody. Take your shoes off. Take your shoes off before you go into your house. Don't wear your shoes inside of your house, because you're tracking germs and who knows what else from wherever you've just wore them from. I have one pair of shoes that I wear to work. I take them off on my porch before I go in my house, and I put them on my porch when I get ready to leave. They don't ever come in my house. If I do bring them in, it's after I've already sprayed them off with some sort of disinfectant spray, when I can find it. But we're trying to get everything opened back up. I'm pretty excited to try to get back to some sort of normal, getting our small businesses open. So in order to do this, we have to continue to be diligent with our hand washing and our social distancing. Hand sanitizer, just keep it. I found this at Lowe's the other day. They had a whole bunch of this there. And but it is hard to find, but you can find it. If you can't find it, I mean, it's going to have to be soap and water stuff, antibacterial soap and water, dial soap, ivory soap. Go back to the basics. Bleach wipes, you can still use stuff like that. Clean off when you bring your groceries into your house. Clean your table or whatever it is that you set them on when you bring them in. Make sure you clean all that off whenever you bring it in. Then the bags that you bring it in, throw those away. Wash your hands. You just wash your hands. Wash them until your cuticles look terrible like mine. But washing your hands, social distancing is the best thing that we've got right now to decrease the spread of this so we can get these businesses open. Because when they open up and everybody starts coming back out, we may see a little bit more of a positive because people are coming out and they are bringing their germs. But just stay aware, because we're going to have to do this for a long time. We're going to have to, several months, we're going to have to be diligent about keeping our hands washed and trying to decrease the spread of germs. And it's something that we should always think about anyway. And we always should have. This is a new normal that we have to think about it more, and how the continuous new normal is going to be on the other side of all this. I don't think any of us know just yet. But right now, to get started with all that, wash your hands, use the hand sanitizer, don't use gloves in public, wear your mask in public, and don't wear your shoes in your house, social distancing 6 feet. Help your neighbors, your elderly population that is in your neighborhoods and stuff like that. Shop for them if you can. If they insist on doing their own thing, then talk to them about the gloves and the masks. If they have problems finding them, there's people making these cloth masks everywhere. Try to help your neighbors, your elderly neighbors, and people that don't have Facebook and social media and don't keep up with all this. Make sure that they all have one and they kind of understand what is to come with all of this. And I'm on Facebook. I do live videos. I try to answer people's questions. So, and I'll always try to help the city of Prestonsburg and help the mayor if he asks. So, until next time, everybody be safe. Wash your hands, use your hand sanitizer, social distance, and wear your masks in public. Thank you.